I see many patients who come to me concerned about the appearance of their legs. They usually use words like lumpy, bumpy, cottage cheese, often believing they have severe cellulite that just won't go away, no matter how much they exercise or diet. While cellulite is a common concern, there's another, often misdiagnosed condition that I want to talk about today: lipedema. What's the difference between lipedema and the cellulite? Hi, my name is Dr. Alex Markelov. I'm a double board certified plastic surgeon specializing in treatment of lipedema. Cellulite is a very common and harmless cosmetic issue related to the structure of your skin. Imagine the connective tissue layer under your skin as a sort of mesh, like a mesh stockings. This collagen network separates fat into small compartments. When fat particles push up against the skin, they protrude through the openings in this mesh. At the same time, some of the connective tissue cords pull the skin down. This push and pull is what creates that characteristic dimpled or orange peel look on the surface of the skin. Unfortunately, there is no definitive way to surgically tighten this collagen network permanently. Treatments like Avilae or sulfina designed to treat cellulite can help with deep, distinct dimples by cutting the specific connective tissue cords that pull the skin down. However, they usually don't help with the generalized orange peel or lumpy appearance. It's also important to note that traditional liposuction usually doesn't make cellulite better and can sometimes even make it appear worse. Now let's talk about lipedema, which is fundamentally different condition. Lipedema is a chronic medical condition, a disorder of the adipose tissue or fat. Unlike the normal fat and cellulite, lipedema fat is different. It's characterized by symmetrical and often painful buildup of abnormal fat, typically in the legs, thighs, and buttocks. The key feature is that the feet are usually spared, creating distinct cuff or bracelet effect at the ankles. In some cases, the arms can also be affected. So how can you tell the difference? I encourage my patients to consider these key factors. First, let's talk about pain. Cellulite fat is typically not painful. The skin might be sensitive, but it doesn't usually cause spontaneous pain or tenderness. Lipedema, on the other hand, is often painful. The affected areas can be very tender to the touch, and many of my patients report a constant dull ache or feeling of pressure in the lipedema fat. Second, consider bruising. While you can bruise easily with the cellulite, it's not a hallmark symptom. Easy and frequent bruising in the affected areas is a very common sign of lipedema. Many women with lipedema find bruises without even knowing how they got them. Third, let's look at the distribution of the fat. Cellulite can appear in more random or patchy pattern on the thighs, buttocks, and sometimes the abdomen. Lipedema fat is characteristically symmetrical. If one leg is affected, the other will be affected too, in a very similar way. It creates a disproportionate column-like appearance of the legs. The upper body typically spared and may be significantly smaller than the lower body. And the final factor, think about texture. Cellulite has that often well-known dimpled orange peel or cottage cheese texture. However, the fat is usually soft. In the early stages, lipedema skin might feel soft as well, but as it progresses, the fat can start feeling like small nodules, lumps, or pearls under the skin, and the skin surface also becomes uneven. Remember that lipedema is not caused by obesity, although it's often misdiagnosed as such. It's a distinct medical condition that has strong genetic and hormonal components. For years, women with lipedema have been told to simply lose weight, and when they can't, they often left feeling frustrated and hopeless. Currently, there are effective treatments, and one of them is tumescent liposuction. This treatment can be used to remove abnormal lipedema fat deposits, and it usually provides a significant relief from pain, improves the mobility and body proportions. However, the degree of skin tightening after this procedure depends on the multiple factors, such as patient's age, skin elasticity, and collagen content. If you have been struggling with what you thought was a stubborn fat or cellulite, and what I have described today sounds familiar, I encourage you to seek a consultation with a healthcare professional who is knowledgeable about lipedema. A proper diagnosis is the first and most important step in your journey. I hope you found this video helpful. Please click the like button and subscribe below.